bicuspid valve, or you can call that mitral valve. If you ever heard of mitral valve prolapse in an infant or something like that, that's a defect with that particular valve there that causes a whole lot of maybe even death in an infant. So really important valves there. The purpose of those valves are to prevent black flow. So you could imagine all of the blood comes into the atrium. Well, that's going to push this valve open. Once that valve opens, it allows the blood to then drain into the ventricle. Once all the blood gets here, that's going to cause that valve to close so that we don't have regurgitation. If we had regurgitation, that's known as a murmur. We have an extra beat in the heart there. So we need this blood to go from here to here without any backflow so that we can continuously pump the blood where it needs to go. And so that's the purpose of these AV valves. Again, on the right side, it's called your tricuspid valve. On the left side, it's called your bicuspid valve, or you can call that the mitral valve. Now, to ensure that these valves open and close when they're supposed to, you got these little strings in here that's attached to the valve. Those strings are called chordinae tendineae. Chordinae tendineae. Cordless-like tendons is what it gets its name from. So you got chordinae tendineae on both sides. Chordinae tendineae. These are the strings that are attached to the actual valve itself. Now, as you can imagine, the heart is nothing but a muscle, so it pumps all day long. That's what it do. So if we have 4 chambers here, the atria and the ventricles, there is no muscles. You can see how the atria are very smooth. That's an inaccurate statement. There is muscles here, but you don't need to know it. Virtually, because the atria are only receiving blood, it's very smooth on the inside. But when you look at the ventricles, you have all of these bumps in here. And those are because of the musculature for pumping blood out to the body. So when you do that, just like a bicep curl, when you work a muscle, it gets thicker, it gets bigger. So your atria are smooth, but your ventricles have these little muscles in it, and these muscles on the inside are called papillary muscles. Papillary muscles. So you have the valves here with the strings called chordinae tendineae, and those chordinae tendineae are attached to the actual muscle here that causes the heart from overinflating when it's pumping blood out to the body. And so here we see papillary muscles on the inside of the ventricles and papillary muscles also here on the inside of the ventricles there. You can also tell that the left side is a whole lot bigger than the right side because the right side is only pumping as far as the lungs, whereas the left side is pumping blood to the entire body, so it's much thicker there. So when we do the dissections, that's going to help you notice right from left as well. The apex of the heart kicks off to the left, but also you can identify the left side of the heart by way of how thick it is and how big it is. Okay, so now we're going to talk about 2 more valves here and here, and then we'll cover in the next video all the blood vessels. We'll cover these valves since we're here. So we have AV valves, this was your tricuspid, and this was your bicuspid or mitral. Now you have 2 more valves, because anytime we go from one location to another, we want to prevent backflow. So when we go and we pump the blood from the right atrium into this vessel here, we got to have another valve here. These are called our semilunar valves. You can see it kind of looks moon-shaped. So semilunar valves. This one is called your pulmonic semilunar valve. This one here, when we're pumping from the left ventricle to the body and to this vessel here, this is called our aortic semilunar valve. So 4 valves on the inside of the heart: tricuspid, bicuspid or mitral, pulmonary semilunar valve, aortic semilunar valve. Those names will make more sense when we do the blood vessels. Okay, so that's it for blood flow and the inside of the heart. We'll do blood vessels next.